Okay, Annette, today we're going to go over the paperwork that you filled out. Looks like your date of birth is May 11th, 1992.
Yes.
Okay, and are you in good health?
Yes.
Do you wear contact lenses?
No.
Have there been any changes in your general health within the past year? It looks like you put yes, and then schizophrenia, sleep apnea, and Sjogren's syndrome.
Yes.
Anything besides those?
Yeah. The the schizophrenia has been diagnosed for a while, but the sleep apnea and the Sjogren's and stuff, I've been kind of dealing with some of that within the last year or so, I'd say.
Okay, within the year. Are you currently under the care of a physician or doctor? It looks like you also put yes for the schizophrenia, the sleep apnea, and the Sjogren's syndrome.
Yeah, I have doctors for everything.
Okay. Have you had a total joint replacement?
No.
Have you had any serious illness, operation, or been hospitalized in the past 5 years?
No.
Okay. Do you have any implants or artificial devices?
No.
Do you have a history of COVID 19?
No.
Are you vaccinated against COVID 19?
No.
And it looks like you are 5'6" and weigh 160 pounds, is that correct?
Yes.
Okay. And it looks like no allergies to anything, no medications, no foods, nothing like that.
No. No allergies at all.
Okay. Are you taking any diet drugs such as Pomidin, Redux, or Fen-Phen?
No.
Are you taking or have you taken drugs such as Fosamax, Actinol, Boniva, Reclass, or any other bisphosphonates?
No.
Okay. Has a physician or previous dentist recommended that you take antibiotics prior to dental treatment?
No.
Okay. And are you taking any over-the-counter drugs, vitamins, herbal supplements, dietary supplements, or hormone therapy? It looks like you put yes, and you're taking a multivitamin.
Yeah, I just took like a woman's one a day vitamin.
Okay.
That's it.
Okay. And then for health conditions, it looks like you have checked sleep disorder. And what is that a condition from?
So that's with the sleep apnea. I've been dealing with that for a couple years, and I do wear a CPAP. That seems to help a lot. I do get dry mouth because I have dry mouth with also like the other syndrome that I have, the Sjogren's syndrome. So the CPAP, I had a sleep study, like I'd say almost a year ago,
Okay.
just to kind of like have everything checked. So
Okay.
so far so good.
Good. It looks like we also checked the box for mental illness or psychiatric care. And what is that from?
That's for the schizophrenia. Um, Same thing. See my physician for that. So I take a medication every day, and that just helps control everything.
Okay. We'll go over the medications on a separate form here.
Okay.
We also checked the box, it looks like, for depression, anxiety, or bipolar disorder. And which is that condition from?
Yeah, so that goes with the schizophrenia as well. So the medication that I take is supposed to kind of help with the bipolar as well, and then the anxiety.
Okay. It looks like dry mouth is also checked. And what is that condition from?
That is the Sjogren's syndrome mainly.
Okay.
Um, the that gives me like severe dry mouth, and I get like some dry eyes with that as well.
Okay.
And then also with the CPAP, it doesn't help, and like double whammy with my mouth. So,
okay.
But I take medication for that as well.
Okay. Any pain in your jaw or joints?
Yeah, so sometimes I get like some jaw pain, and that's I think related to the autoimmune disorder that I have. So not all the time, but I would say like if I'm in the dental chair and stuff like that, sometimes I might get some pain, like holding my mouth open a little bit.
Okay. And then it looks like okay. It looks like the last box we've checked is the autoimmune disorder, and which is that from?
Yeah, so that's for the Sjogren's as well, the syndrome. So
Okay. And then,
ugh,
any other serious illnesses besides any of those that we went over?
no, that's pretty much it that I can think of.
Okay.
That's enough. I don't need anything else.
It is a little bit much. And then it looks like for the trying to get pregnant or pregnant, you put no, no for nursing, and then it looks like you are taking an oral contraceptive.
Correct. Yeah.
Is it the patch, pills?
I take a oral pill every day, one time a day.
Okay, all right. I'm sure it's on your medication form, so we'll go over that in a little bit too.
Mhm.
All right. Do you have dental examinations and cleanings on a routine basis? It looks like you put yes. That's great.
I try to stay consistent. This last year's been a little bit crazy, so
Mm-hmm.
it's been probably about a year since my last visit.
Okay.
So that's why I'm here today.
Is that your main concern for coming in today, or is anything else bothering you?
No, no, no problems. Just want to get my teeth cleaned.
Okay.
Notice like my little bit of bad breath and stuff, so I know I'm a little overdue.
Okay. But generally, you felt pretty good about your dental visits in the past. It looks like you checked the looking forward to it box. So
Yeah, I like going to the dentist. I like getting my teeth cleaned.
good. That's a good attitude. And have you experienced any of issues with your mouth in the past 2 years? It looks like you mentioned before dry mouth, maybe some clenching or grinding, some bad breath. Anything else besides those?
No, I think the dry mouth has been the biggest problem, and then I think the bad breath comes from that.
Okay.
Constantly having the dry mouth, and then sleeping with the CPAP doesn't help.
Yes.
But no, no other issues. I would say maybe like the bad breath and stuff is the biggest thing I've noticed lately. No, no tooth pain.
Okay. It looks like you use a soft powered toothbrush at home. And then looks like you're doing
Yep.
flossing, using an oral irrigator and mouth rinse. Any other devices or any home care practices that you use besides those?
No, those are that's enough. Spend
Yes, you do a lot. That's good.
a lot of time.
Yeah. And then it looks like you use toothpaste that has fluoride in it, which is also a good choice too.
Yeah.
How many times a day do you brush your teeth?
2 times.
Twice. Okay. It looks like you brush them for 2 minutes each time. That's good. That's the
Yeah, I just kind of follow what my electric toothbrush
Oh yeah, it's
has a
got
timer. It has a timer, so I just try to use that.
Okay, good. And then how many times a day or week do you floss? Looks like you floss every day. Is that right?
Yeah, I try to floss every day.
Good. And you floss your entire mouth every time?
Yep.
Perfect. Do you feel like you ever have difficulty in adequately cleaning your teeth sometimes?
Um, I would say maybe.
Okay.
Um, Not too much. I think for the most part it's pretty straightforward.
Okay.
But
Yes. And then do you live in a fluoridated community?
I think so. Yes.
Okay. And do you use a water filter or bottled water for your main drinking water source?
Bottled water mainly.
Bottled. Do you use any form of tobacco?
No.
And do you consume alcohol?
No.
And then any sweet and starchy foods. It looks like on a regular basis you talked about the breath mints and the candy. Just kind of try
Yeah.
to keep up the saliva. Okay.
Yeah. I try not to do it too much because I was told before, the dry mouth. It helps with the saliva, but then the candy. So
Yeah.
try to stay brushing my teeth if I can. But
Yeah, that's good. How important is it for you to prevent cavities, gum problems, or other diseases of the mouth? You put very important, which is obviously why you're
yes,
here today.
very important.
Okay, good. And then, do you feel like you have a good control over the condition of your mouth?
I would say I think sometimes for the most part.
Okay.
Um, Maybe just challenging with the dry mouth, but I try to definitely like take care of my teeth if I can.
Good. That's good. Okay, let's go over those medications now. The first
Okay.
one you've put down is the chlorpro. chlorpromazine.
Yep.
You take 50 milligrams 3 times a day. Is that right?
Yes.
And what do you take that for?
That's for the schizophrenia and the bipolar.
Okay. All right. The next one is the pilocarpine. You take 5 milligrams 3 to 4 times a day. And what is that for?
Yeah, that's for the dry mouth for the Sjogren's syndrome.
Okay.
So that's the main medication the doctor has me on. So that's why I try to avoid the candy as much.
Okay. Good. That looks like the next medication is the cyclosporine. You take it 2 times a day. And which condition is that for?
That's for the dry eyes. So with the Sjogren's, I also have severe dry eyes along with dry mouth.
Okay.
So those are anti-inflammatory eye drops.
Okay. The prednisone, it looks like you only take that when you have an autoimmune flare-up. Is that right?
Yeah, so sometimes with the Sjogren's, I might have some issues. So it's not like an all the time thing, but if I am having like a flare up, then that's the prednisone is what they usually will prescribe.
Okay.
I haven't taken that one in a little while.
Okay, that's good. And then you take the Criselli tablets. That's the birth control. Is that correct? Once a day.
Yes.
Okay.
Yep.
Are you
no babies.
Are you taking any hormones or hormone replacements?
No.
And then vitamins and minerals. It looks like you're just taking a women's multivitamin one a day.
Yep.
Okay. And any other supplements or medications that you can think of?
No.
Okay. Good. And our last form. Are you employed in an occupation which exposes you to X-rays or other forms of ionizing radiation? It looks like you put no.
No. I'm a stay-at-home wife.
Awesome. Have you ever had radiation therapy in the head and or neck area? You also put no.
No. Okay. Correct.
Correct. And have you been exposed to extensive medical radiographs within the past 5 years? Looks like you also put no. Is that still correct?
Correct.
Okay. No. And then have you been exposed to a full mouth series within the past 3 to 5 years? It looks like you put yes.
Yeah, I think I had all of the X-rays about a year ago at the last visit. I remember I went in there and they took a lot of films, and then they also took one that rotated around my head.
Okay. That's the next one. So it looks like you did have a piano then within the past 3 years. Okay. And have you been exposed to bite wings within the past year? That's the one they put in your mouth and you bite down. It's a little uncomfortable usually.
I guess maybe.
Okay.
Would they have done that with the FMX?
Yes. Mm-hmm.
I remember she called it.
Yeah, the full mouth series.
Oh, okay.
Yeah.
Yeah.
Okay, perfect. Well, okay, that paperwork all looks good. I'm gonna go grab the doctor, and then they'll be in to come in and see you.
Awesome. Thank you.
Mm-hmm.